A patient today came into the office and said that they needed treatment for their use of Ambien or Zolpidem. They had been taking Ambien or Zolpidem prescribed by a physician for about 10 years. And over time, they noted that their dose had escalated. So they started off by taking a 5 milligram pill as prescribed by their provider. Then over a few years, they moved up to a 10 milligram pill when their sleep became more problematic again, in particular during a stressful time. A few years later, they increased it again to 15 milligrams. And at the point of time of our evaluation, they were taking 20 milligrams a night of Zolpidem or Ambien. Now, just so that you know, Zolpidem is FDA approved to 10 milligrams at night. So this person was taking twice the FDA approved amount of medication each night. And while that may sound pretty high, and it is pretty high, it's not shocking that sometimes patients will come in and they'll say, hey, a provider out there put me on this medication. And some people end up on a medication dose. And when you look at how this happened, it makes sense and it was reasonable at the time, but you may get to a point where you say, you know what, let's see if we can get this person off this medication, or maybe they're on a little bit too much medication. And in general, when you prescribe medications like Ambien, sedative, hypnotics, benzodiazepines, you want to make sure that you're only using them if the person really is not going to benefit from your non-controlled medications, and if they're really having significant problems with their sleep where it's reasonable to write them for those medications. And you always want to try to write them for short-term use if possible. But sometimes patients do end up on these medications, and sometimes they end up on these medications being prescribed them by good providers. I do want to be clear about that. But there are also providers out there that maybe are a little bit more liberal with their use of certain medications, and patients may end up on higher doses and then have significant problems coming down or off of them. And in this case, the individual is actually having increased anxiety the next day, and that anxiety would escalate up until about evening time or a little bit later when they were taking their next dose of Ambien. And what we talked about was what we were actually seeing. Medications that are benzodiazepines and are used for sleep, they typically have a half-life where when someone takes it, most of the medication is going to be leaving their system by the time they wake up or shortly thereafter. And the reason for that is that you don't want to feel groggy and sedated and be asleep the whole next morning. You want the medication to wear off, to work when you go to bed, and then to wear off by the time that you wake up. Well, if someone is developing a tolerance for a medication like Ambien, which is Zolpidem, or a benzodiazepine, and they're taking it for sleep, they're developing a tolerance where they need more and more over time to get the same effect with their sleep. And they are either taking themselves or being prescribed by a provider more and more of that medication over time. Then what can happen is, even though they're needing more to get that same effect with regards to the sleep, and even though they might not be feeling groggy the next day, they're actually becoming dependent on the medication, where as you increase your doses, then the amount of medication in that person's system is actually going to be higher during the next morning and during part of the next day than it would have been on the lower doses. So you're just taking a bigger amount of medication. It's going to take longer to leave your system. And when you start to get the doses of 15, 20 milligrams of Ambien, 25 milligrams, 30 milligrams, you're basically becoming physiologically dependent on it. And it's as if that medication is in your body 24 hours a day. And since medications like Ambien and benzodiazepines and similar medications work on the same neural pathway of alcohol, you basically will have the same type of withdrawal as if you were drinking alcohol throughout the day, every day. And withdrawal from Ambien, withdrawal from Klonopin, Xanax, Ativan, Valium, all these benzodiazepines and benzodiazepine derivative medications looks exactly like alcohol withdrawal, which will often be a great deal of anxiety, feeling jittery, feeling restless. You could start to get tachycardia, so your heart might race. And in severe withdrawal, you could actually have a significant tremor, have seizures, have unstable vital signs, and it could actually be lethal. So I wasn't as worried about this person having a lethal effect from their Ambien use. But it was very clear that, all right, now your body's used to such a high dose of this medication that you're having withdrawal anxiety during the day from using it. You're relieving that anxiety by taking this medication each night. You're taking higher doses over time. And I think that it's time to get you off this medication. And so we devised a plan to slowly taper this individual off of the Ambien. They had been on it for 10 years. So slowly taper it with the assistance of their significant other and their family to make sure they were taking it as prescribed, to make sure they weren't getting additional medication anywhere else, to slowly have them decrease that medication. And we also, by doing a thorough evaluation and looking at their mental state before they were on this medication, we were also able to realize that they did have an underlying anxiety condition that made them more vulnerable to needing a medication for anxiety, and more vulnerable to basically being in a situation with increased anxiety during the day, and this kind of vicious cycle. And so we talked about using a non-controlled, non-addictive medication like an SSRI, and starting that in the background with the hope that once they were completely off of the Ambien, we would likely be able to peel that away with a little bit of time of them doing well. But this is, I think, something that's very important to talk about. Some of these medications that people are prescribed, and often by good providers, they can end up just being left on the person's medication regimen a little bit long, and they can end up at high doses. And it is important to always consider, does this person need this medication, and can we taper them down on this medication, and are we doing more harm than good? If you have any questions about this video, the content in this video, or feel that it's applicable to you in any way, please be sure to reach out to a mental health or medical professional to set up an appointment.